Welcome back to Pharmacominds. Today, we're taking on one of the most dreaded but unavoidable corners of pharmacology, the classification of beta blockers. Anyone who has sat with a pharmacology book knows the pain of staring at endless drug names that look and sound almost identical. But once you understand the classification and learn the right hooks to remember them, things suddenly start making sense. So, let's start with the big picture. Beta blockers are a class of drugs that block the effects of adrenaline and noradrenaline on beta receptors. These receptors are scattered in the heart, lungs, blood vessels, and other tissues. Depending on which receptors a drug prefers to block, we classify beta blockers into three main categories. The first category is the non-selective beta blockers. These drugs don't discriminate between beta-1 and beta-2 receptors. They block both. That means they affect the heart, the lungs, the vascular system, everywhere. In clinical practice, some of these drugs are used for conditions like angina, arrhythmias, migraines, and even glaucoma. The problem, of course, is that because they also block beta-2 receptors in the lungs, they can cause bronchospasm, which is not ideal for asthmatic patients. The list of non-selective beta blockers includes propranolol, nadolol, timolol, pindolol, cartiolol, penbutolol, and sotalol. 7 names that are not exactly easy to recall during an exam. Then we move to the second category, the cardioselective or beta-1 selective blockers. These are more polite. They focus mainly on the heart and have less effect on the lungs, making them safer for patients with asthma or chronic obstructive pulmonary disease. Clinically, they are widely used for hypertension, heart failure, and ischemic heart disease. This list is a little longer. It includes atenolol, metoprolol, bisoprolol, nebivolol, acebutolol, celiprolol, betaxolol, and esmolol. 8 names, again a challenge if you're trying to memorize them one by one. Finally, we have a smaller but important group, the beta blockers that also block alpha receptors. These drugs have a dual action, bringing down blood pressure not just by slowing the heart, but also by dilating blood vessels. The 2 key players here are carvedilol and labetalol. They are especially useful in heart failure and hypertensive emergencies. Now that you have the overall structure, let's make these names stick with mnemonics. Starting with the non-selective group. To recall those 7 drugs, we use the line, "Please never tell people creepy and paranormal stories." Each word represents a drug. Please for propranolol. Never for nadolol. Tell for timolol. People for pindolol. Creepy for cartiolol. And paranormal stories for penbutolol and sotalol. Instead of seeing a messy list, you now imagine someone telling paranormal stories at night, and suddenly the names fall into place. Now, the cardioselective group. For these 8 drugs, the mnemonic is, "A man became nice and cool because of emergency." A for atenolol. Man for metoprolol. Became for bisoprolol. Nice for nebivolol. And cool for acebutolol and celiprolol. Because for betaxolol. And emergency for esmolol. Again, rather than struggling with random syllables, your brain ties them together in a sentence that flows. And for the dual-action beta plus alpha blockers, there's a simple way to remember. Think of a cigarette lighter. The word lighter helps you recall labetalol, and the flame sparks carvedilol. Just 2 names, but their unique property makes them stand apart. So, let's bring it together. Non-selective beta blockers, propranolol, nadolol, timolol, pindolol, cartiolol, penbutolol, and sotalol. Cardioselective beta blockers, atenolol, metoprolol, bisoprolol, nebivolol, acebutolol, celiprolol, betaxolol, and esmolol. And the beta plus alpha blockers, carvedilol and labetalol. And to save yourself from the misery of cramming, just keep in mind the haunted paranormal story, the man becoming nice and cool in an emergency, and the image of a cigarette lighter. Beta blockers are one of those drug classes that keep returning in exams and clinical discussions. Once you nail down the classification and mnemonics, you have cleared one of the most frustrating hurdles. And that wraps up today's session on beta blocker classification mnemonics. If this helped you make sense of the names and their categories, Make sure you share it with your friends who are drowning in pharmacology notes. And subscribe to Pharmacominds for more topics, where we simplify complex pharmacology into something you can actually remember. Until next time, keep learning and keep pushing forward.